Yeah, focus on the video.
Okay.
Excellent. So we are live. Okay, and we are 1 minute ahead of time, over time. So let's start. I would like to present the moderator. First of all, I want to welcome all of you here, and I'm going to present the moderator of the show, Dr. Damon Downs. Okay.
Yay. How's everybody this morning? It's a wonderful morning. Welcome to the 6th Annual Women in STEM Forum. And we have an incredible forum today with incredible presenters, panelists, and I'm just so excited about this morning. I'm pretty sure a lot of people will get a lot of great information out of this forum today. What I'm going to do is I'm going to start out with, I really want to basically point out that I'm going to start out with the dean first, but I want to make sure everybody's clear on some housekeeping rules though, and that is please keep your microphones muted, okay? And you can please keep your video off. After I actually ask the panelists certain questions,
has joined the meeting.
I'm sorry, after I ask panelists certain questions, I would invite everyone, if you could please share a question for the panelists after that actual discussion. And then what you could do is, if you have a question, you can put Q in your actual chat box, and then I'll basically note that, and then you can ask your question. You become unmuted, and then you can ask your question. Okay. But if so, basically, if you guys could please just make sure, just at the top there, I just want to make sure we're clear that you guys have your microphones muted, if you could. Okay. That would avoid any of the extra sounds as people are speaking. All right. Let's go to, if you will, our wonderful dean. All right. And that is Dr. Marilyn Hamilton. I'm pleased to present Dr. Marilyn Hamilton. She has served as our acting dean of academic affairs at the University of District of Columbia Community College since 2014. And she's been the dean, actually, of the academic affairs since 2017. She has served as college co-team leader for Achieving the Dream and Complete College America. She has given incredible support for our nursing, allied health, life, and physical sciences department by helping us manage our accreditation process, planning and implementing our technology strategies, and providing progressive leadership within our community college family. This is a short list to describe Dean Hamilton. She is a superwoman, regardless of what Babyface's hit song says. She does it all. And let's welcome Dean Dr. Marilyn Hamilton, please.
Good morning, everybody. How is everybody this morning? Good. I think usually after a presentation like that, we need to be playing the song "I'm Every Woman," but we would skip for now. So, Dr. Downs, I want to thank you for your kind words of introduction. So, to everyone, welcome to the 6th Annual Women in STEM Forum. I really enjoy coming to this to these convenings every year and look forward to them. The aim of this event is to encourage more and more female students, particularly those of color, to major in a field of study leading to a career in a STEM field. From the list of presenters, I know that we're going to be in for a very informative and stimulating discussion. So let's continue and and enjoy the forum. Thank you.
Thank you so much, the revered Dr. Hamilton. Thank you so much. And so let's go ahead and proceed now to our keynote speaker, giving the keynote address. That's Dr. Victor R Mccrary Jr., our keynote speaker. He is the Vice President of Research and Graduate Programs at the University of District of Columbia, where he leads the growth, development, direction, and oversight of the university's research enterprise. Having held similar research leadership positions at the Johns Hopkins University Applied Physics Laboratory, Morgan State University, and the University of Tennessee, he is seen as a change agent and serial innovator. He's responsible for developing comprehensive, sustainable research strategies, fostering transdisciplinary research, and expanding research programs through the engagement with federal and state agencies and private entities. He has made significant contributions to Morgan State University, becoming one of only 130 universities nationwide to have an R2 status in the Carnegie classification of institutions of higher education. Dr. Mccrary has served 2 terms as the national president of the National Organization for the Professional Advancement of Black Chemists and Chemical Engineers. He is a fellow of the American Chemical Society. Dr. Mccrary began his STEM education here in Washington, D.C. at the Catholic University of America, where he received a bachelor's degree in chemistry. He earned a master's degree in engineering management from the University of Pennsylvania and his doctoral degree in chemistry from Howard University. Dr. Mccrary has authored and co-authored more than 60 technical papers and co-edited 2 books during his career at AT&T Bell Laboratories and the National Institute of Standards and Technology. He has received numerous honors and awards, including co-recipient of the U.S. Department of Commerce's Gold Medal in 2000 and the 2002 National Organization for the Professional Advancement of Black Chemists and Chemical Engineers Percy Julian Award in 2011. He is was honored as Scientist of the Year by the annual Black Engineer of the Year Award STEM Conference in 2014. And in October 2016, former President Barack Obama appointed Dr. Mccrary to serve on the National Science Board, which oversees the National Science Foundation. In May 2020, he was selected to be the Vice Chair of the National Science Board. Please join me in welcoming our esteemed keynote speaker, Dr. Victor Mccrary Jr. And in addition to that, he has the same surname of the incredible Michael McCrary as well from the football team I love, the Ravens. All right, Dr. McCrary.
Thank you, Mr. Downs. I really appreciate that. I'm a lifelong Washingtonian, and I'm a fan of the Washington football team, so I won't hold that against you. But I will also say I want to thank Dr. Saeed, you, Mr. Downs, Dean Hamilton, and all the rest of the UDC, University of the District of Columbia Community College team for, again, putting this event together. And I am honored and humbled to be your keynote speaker. This event has gone on for a couple of years since I've been here. I'm just amazed about the number of people who are participants. And also looking at this year's panel, you know, my mother was the first woman I encountered in STEM, but even before it was STEM. She was a first lieutenant in the U.S. Army Corps, nursing Army Corps during the Korean conflict. And back then, that was a path for Black women to go into and to really learn skills that would be able to be viable jobs. And so, you know, she's buried at Arlington National Cemetery. She served our country. But I want to say for the women who are here on this panel and the women who are looking at this, I wish I had more mentors. You are around, because I think going forward, this is the great opportunity going forward for women, particularly women who are pursuing STEM. It is a great opportunity for the University of the District of Columbia. I'm going to share a presentation because I hope you all can get back. I don't know how many of you all are a little bit religious or not, or patriotic, but I'm going to kind of sound a little preachy in these next few minutes and be a little patriotic, because this is a call for action. And I think the panelists that you have to hear will sanction this message and kind of affirm it, because it's a great opportunity, but we're also at a moment. And so before I share this, let me actually share this presentation right now. So this should be coming up to you all. Okay, great. And I believe you can all see that, correct?
That is correct.
And what I'm going to talk about right now is the need right now for our country to develop diverse domestic STEM talent. And this is what the nation really needs now. And this is what I'm calling not only for all of the women here today, particularly the women, but as well as the men, but particularly the women and your colleagues both male and female, because there is a sense of urgency. In May of 2030, as Mr. Downs has said, I was asked to be selected to be the vice chair for the National Science Board, which oversees the National Science Foundation. But also at that time, under the leadership of Ellen Ochoa, who is currently the chair, and I believe one of the colleagues of one of our panelists here, has come out with this Vision 2030. And this is a document that talks about where the nation needs to be over the next 10 years in terms of research, but also where we need to be as a country because of our basis in research. And when we look at that vision for the future, the question is, we hope that the US remains competitive in terms of science and engineering talent, that we have the workforce, that it's accessible to every demographic of our nation. We can't continue to be a country that talks about the values of freedom and economic development and have national security if we have 30 to 40% of our people sitting on the bench. And that means we need to make the investments in both industry, government, but academia, and all of academia, not just four-year institutions, but our community colleges. And we need those scientists and engineers, and we need to continue to drive innovation. So why is that important? If you look at our ecosystem, the way we operate today in our country, that science and engineering ecosystem involves government, not only at the federal level, but for example, the district government, who funds the University of the District of Columbia, academia. And again, like I said, it's not just four-year universities, but trade schools, community colleges, K through 12, and also business industry, our business associations, our entrepreneurs, the folks that we work with for the foundations and the nonprofits that help our community college. And we've got to answer these questions. Can we keep our lead in fundamental research? Can we continue to empower our businesses and entrepreneurs to succeed globally? And can we increase the skills and opportunities in STEM for all Americans? If you look at this slide, if you don't remember anything else about what I have to say today, you have to see that over the past 20 years, we have ceded our lead and our reduction in R&D has decreased globally. And right now, in the industries of the future, artificial intelligence, quantum information systems, biotechnology, 5G, and advanced manufacturing, we are losing ground to other players globally, in particular China. And if we don't take action, a call to action, we will lose our lead and our quality of life. So we put out this roadmap and had 4 areas that we thought were important. But let me just cut to the chase. The most important area is developing diverse domestic STEM talent for America. Because you know what? If we don't have the talent, we don't have the research, we don't have the innovation. And this is the action that we have to take right now, is developing that talent for America. And that's where you all can make a difference. Because right now, it's the missing millions. If you look at right now, for the past 10 years, in terms of science engineering, in terms of number of Black folks in science and engineering, it's stuck at 4%. For Latinx, it's at 6%. Women have made improvements, but none of these groups are at population parity. Again, I say, how are we going to compete if we've got a third of our team on the bench, people who are ready to go? And that's where the University of the District of Columbia comes in, and that's where you come in. Because in a sense, as the district's only preeminent public urban land grant HBCU emerging research university, we are here to be the District of Columbia and the DMV region's research laboratory. And basically, what we're going to concentrate on is urban sustainability and urban resiliency. Because in the next 25 years, 75% of the world's population will be in urban environments. And so there are plenty of research challenges: climate and energy and resource management, transportation, health prevention. And by the way, when this slide was made, when I first gave this talk was in 2012. And what I talked about is how are we going to handle a pandemic? Now, I'm not saying that I was prescient in that, but as you can see right now, we have challenges of how do we operate if we had an outbreak. Aging populations. nutritional food, resiliency, communications. So one of the things I want to say today is UDC and the District of Columbia Community College is poised as we become an emerging research university. If you look at these numbers, when we closed the books a month ago, we had over 49 million in proposals submitted by our faculty, from the community college all the way up through the law school. And we brought in 43 million in awards, which is a record for the University of the District of Columbia. So I just want to let you know you are part of an institution that is moving forward and part of a winning team based on the equity of parity imperative and the leadership of President Mason and our provost, Dr. Lawrence Potter, as well as all the executives and leaders, the leaders of the community college like Dean Hamilton, the people in workforce development like Dean Smith, and then obviously Dr. Saeed and her team. But across the university, we have a winning team. And just wanted to show you some of those wins. We've signed an MOU with the Applied Research Laboratory at Penn State. Penn State is an R1 research institution. And this MOU will offer internships for our students, permanent hires, as well as faculty research. We have 4 major centers, which are almost close to well over $20 million at NIST, NSF, NASA, and the Department of Energy. We are working closely again, talking with NASA because they're right in our backyard. And they need people, employees, both who are skilled at the skilled technical workforce, 2-year degrees, 4-year degrees. They are looking for folks like that. And we have somebody who is a NASA astronaut on the panel, and I'm sure she's going to talk about those opportunities. We've got faculty recognition. One of our faculty members, Dr. Tiagi, was rewarded as the Black Engineer of the Year HBCU Innovator. And we have been involved. In fact, for the past 3 years, we have a number of our faculty who have been highlighted nationally for what we do in our contributions to research. You know, you can see Dr. Laura Thompson here, who was in 2019 an HBCU Innovator and now being recognized by the National Science Foundation. We are also working with the defense community, and we have received $300,000 to Dr. Brianna Wellman in the School of Engineering to help develop and enhance our cybersecurity curriculum. And let me tell you, if you can get a certificate or a 2-year degree or 4-year degree in cybersecurity, you are golden as far as I can see for your entire career, because it is a profession that is in demand. It's a profession not only needed in the intelligence agency, but they need it for our contractors. We need it in healthcare. We need it in finance. And again, this is where you can get that start at the community college here at the University of the District of Columbia. We also just signed an agreement with the Navy, and I see we have a person from the Navy on the panel because there are great careers in the Navy. And so please listen to our panelists, look at these opportunities. And then our organizer, Dr. Saeed, was recognized just 2 weeks ago, okay, for her educational leadership as a woman of color in STEM. I guess what I'm trying to convey to you is UDC is out there nationally. People are looking at us. We're making a difference. And I'm asking you, both students as well as panelists, that you're part of a winning team and to take this education because there is a demand. Just here, if you look at the other research intensive HBCUs, okay, which are Carnegie designation R2, while UDC is designated as an M2, if you look at our numbers, we compete with the Clark Atlantas, the Delaware States, the Texan Southerns, the University of Maryland Eastern Shore. UDC is a winner and an emerging institution. And again, under the leadership of President Mason and Dr. Potter and others on our team, we are moving forward. Just this year alone, our NSF research expenditures were $1 million. And if you look at our total research expenditures, close to $5 million, and we're starting to crack that ceiling and getting there with these other research intensive HBCUs. So I just want to leave you with this thing. Businesses large and small, and you can see the age of this slide because this was quoted when I was at Morgan State, are looking for a strong, diverse, STEM-based workforce, and it's essential to our prosperity. When we think of just of the National Science Foundation, its mission hasn't changed since 1947. It's fundamental research, economic development, and national security. And getting back to my mom, when I was born, 3 years later, there was a satellite that went around the Earth. It was called Sputnik. And everybody reacted because the Russians had put it up, the Soviets at that time, and we were concerned about our lead in science and engineering. I was a beneficiary because then they passed the National Defense Educational Authorization Act. We learned a new math. Tons of books were poured into DC public schools. Labs were renovated. Well, you know, right now, we're at a Sputnik 2 moment right now. We're getting our rear ends kicked by China and other nations. And we need your help. And we don't just need the men as it was in the 1960s. We need the women, the men. We need everyone, black, white, red, yellow, across this city and this region to get involved in science and engineering. So I ask you today to please take the comments from these panelists. I'm asking you to get involved. There are plenty of jobs that are out there right now, whether you have a 2-year degree or even if you just have a certificate. I mean, for example, in our aviation maintenance program here at UDC, you can come out, leave high school, and have no mechanical aptitude, and in 2 years you can have an FAA certificate that will pay you $65,000 or $70,000 a year. And just think about that. There's many on-ramps and opportunities, because then in a couple of years you could go work for while you're working for Southwest, they may come back and they may say, hey, look, Marilyn Hamilton, I would like you, for example, to go get your bachelor's degree in mechanical engineering. And by the way, I'll pay for it. So this could be your entry right here. These STEM opportunities are abound. Our country needs you. We need you here at UDC. We are the mechanism for you to make your dreams and future happen. Thank you, Dr. Saeed. I want to thank the panelists. Thank you, Dean Hamilton, and enjoy the rest of your conference. And I'll turn that back over to Mr. Downs now.
Yes, thank you so much, Dr. McCrary. It was incredibly informative presentation there that allows us to reflect on the incredible achievements that are made in our university and college. So thank you so much for that. Also, making sure that it's confirmed, we understand this is the place where you can get a jump start on incredible careers. So thank you so much, Dr. McCrary. We're going to move our way to Dr. Olanai. And so basically, Dr. Olanai, I'm excited to present him, very distinguished colleague of mine. He will be speaking on careers in public health. Dr. Olanai, he joined the University of the District of Columbia Community College in the fall of 2017. He holds a master's and PhD degrees in public health from Walden University. Dr. Olanai has been very active in public health content and methodology in areas of dissertation mentoring and respiratory journal peer reviewing. Dr. Olanai has consistently worked with the American Public Health Association and the Society for Epidemiologic Research as conference abstract vetting epidemiologist. He had also worked with private public health organizations in Maryland in areas of health planning and promotion. Dr. Olanai joined the University of the District of Columbia as assistant professor in the fall of 2017, where he continues to encourage and expose respiratory students to research methods. In addition to his public health initiatives and work with students here at the university, Dr. Olanai is a family man. He is married with 3 children. Welcome to our forum, Dr. Michael Olanai.
Thank you very much, Dr. Downs. Welcome, everyone. I'm honored to be invited for this presentation. Public health, just as the name implies, means that it's a health for the public, that's for the populations. The definition of public health can be varied. It depends on who you're talking to. But what is generally understood is whichever way you define public health, it's good to bear in mind that it cuts across 3 tiers, which you might call it levels if you want, as a primary, secondary, and tertiary. So it's basically based on organized efforts and educated choices of the society, its organizations, and of course, individuals. In other words, public health is population health. So that's basically the definition of public health. Now, how do you differentiate public health from medicine? Because a lot of confusion lies within that. Public health, as I already mentioned, is for population. It focuses on community, a lot of attention to vaccines, disease surveillance, that is detection of disease, watching out for outbreaks and all things like that. Things like a new drug investigations, you might be thinking about FDA if you want. Those are public health stuff. Investigations and approvals of this new medicine and medical equipment, everything that has to do with safety of the public. You might also think about advocacy, people trying to make things work, link up with politicians, make things work, work towards creating laws that will favor the safety of the community. Those are public health.
Dr. Olani, do you have a PowerPoint to share?
Do you know what a share button is, Doctor? Because you can share it, or do you want me to show you what I have?
Can you please, okay, let me see if I can share from here. I thought you're gonna be putting that up, but that's fine.
Yeah, but well, that was if you couldn't put yours up, but you do have, yeah, there you go, all right?
All right, okay, okay. All right, I just discussed about the second slide, which is where I just finished that. Okay. The slide number 3 now. Okay. Medicine, on the other hand, focuses on the individual, that is you and your doctor, just one-on-one. They're focusing on the clinical aspects of treatment, if you want. So there's also this belief that people don't understand the difference between public health and medicine. The two are actually, intertwined. So it's difficult to actually separate them because you have a public health officials working in medicine, and you have medical officials working in public health. When you have a doctor with an MD, and then you have MPH after that. Now, that sounds a great indication of public health involvement. You can actually go down further to get a PhD in public health and you still be a medical doctor. So generally, there is a thin line between public health and medicine. So I'm going to go to the next slide. And that will be, okay, the careers now. What are the careers in public health? Now, in public health, it's like all over the place. Wherever you're talking about the safety of the society and the prevention, things like that, that qualifies as public health career. But overall, there are 6 broad areas, which can also be subdivided into subspecialties. And these 6 areas are epidemiology, biostatistics. In some countries, they call it medical statistics. In some other countries, they also call it public health statistics. So it's the same thing. Now, the third one is health policy and management, which could also include planning and promotion. These are the administrators and the people who make policies, who decide what to do and things like that. When to initiate a recall, like a safety, like a meat, a contamination, all kinds of things. Or you may think in the context of CDC, NIH, and things like that. So, but it's not limited to those high places. You can have health policy and management in corporations, institutions, and so on and so forth. Now, social and behavioral sciences. which has a lot to do with the psychologists and things like that. It's a kind of a very complicated situation there. The environmental science, people who actually decide how safe the environment should be, global warming, all kinds of things like that. And then nutrition and dietetics, people who actually advise on what to eat to stay alive and prolong life, how to control obesity, which is a very public health crisis in the United States. They are highly trained and they span across all the levels of a public health, their primary level, secondary level, or tertiary level. Now, how do you get educated if you want to find a career in public health? Now, the basic education typically keeps changing. It keeps evolving, just like other health careers, like physical therapy, pharmacy. They keep, in public health, things keep going up too because requirements keep changing. Typically, a bachelor's degree might be okay, but you can also find associate degree, not very common, but you can find them. So employment that you could get through this would be people like a nutrition assistant, maybe possible through the associate degree. Now, for masters in public health, which is the most recognized entry point, it is the actual professional entry, which is you want to make sure that you go to a self-certified school, and that self means a Council of Education on Public Health. For PhD and DRPH, a lot of confusion there. PhD is more about research. It's not that DRPH, they don't do research, but it's a lot more intensified in PhD. Both of them can also teach. It takes longer for PhD when you talk about that education required for that. And more people in PhD get involved in dissertations and all kinds of research things. The differentials are what you have, and they are both doctorate degrees. Now, medical doctors, as I mentioned earlier, they can also be public health professionals, especially with identifying degrees like MPH and PhD. They can participate in research, teaching, surveillance, medical biostatistics, and report new cases through. And we actually value their activities because, especially those working in the ER, they are usually the front line in detecting early outbreaks. The data that comes from ER, they actually assist public health a lot to detect early outbreak, so that there could be a quick follow-up. So you also have ICU physicians and OR physicians. They do research to correlate or predict and all kinds of things, just to make sure that we check all these diseases. Infectious disease specialists also monitor the nature of infection, the origin, and how to control it. All these are data-driven. Now, how do you consolidate your qualification in some public health degrees or certificates if you want to actually look for a job and then make sure you're an expert? So, in health educators, they have the CHES, which is Certified Health Education Specialists. This is like the entry level to that. That actually distinguishes you as a health educator right away. And then you have the MCHCES. Well, that is the master. Master is an advancement over CHES. These are people who are experienced in the industry. You have to have some kind of experience to even qualify to take that examination. So the organization doing both chairs and M-chairs are the National Council on Health Education Credentialing, NCHEC. Now for CPH, those are mostly statisticians, they are more into methodology. So the accrediting agency for that is a National Board for Public Health Education. And then for certification for nutritionists, you have the National Academy of Sports Medicine, so NASM, American Academy of Nutritionists and Dietetics, AAND. Infection control people also, they are certified in infection control, and that's the credential right there, CIC. And they already must have been working in infection control, such as in public health nursing, and some of them might be MPH holders already. This usually involves critical roles in infectious diseases surveillance also. So, and the example of where this is found is ER, as I mentioned earlier. But you can also find out these outbreaks from schools. That could be the origin. So you could also trace outbreaks from prisons, where you have all these crowded populations, and that's why all these infection control, outbreaks could be traced. Then, for telehealth is becoming more and more popular. You have technicians who manage this, electronic health technicians also, and then people rely on survey and data collectors, and then contact tracer, which is now made more famous by COVID-19. It has happened, it's not new, but it just became more popular with COVID-19 because of the nature of that virus. Now, to summarize, and I'm going to just select some professions. PhD and DRPH, teaching and research. These are the top industry professionals. They could be employed in the areas as director of public health for counties or state or cities. They could be epidemiologists for those areas, and they could be biostatisticians. They could be principal investigators for the research endeavors. And they could just be public health consultants and policy advisors to politicians, to schools, to universities, and things and so on and so forth. So they also could be involved in health planning and promotion. They could also be health educators at a higher level. For the MPH holders, they could mostly involve, they could be involved in the program planning and promotion, community health, health educators, biostatisticians, environmental scientists, nutrition, weight loss counselors, dietitians, food technologists. For the bachelor's holders, which is growing a little bit extinct now as the entry level, so program planning, health educators, environmental science, public health programs are becoming less available in this particular category in the United States. So very rarely you have from associate degrees offering a public health, and they still get their job too. A nutrition assistant, they could be data collectors, they could supervise surveys and things like that. How much do you actually make if you are in public health? Now, these are selected professions which it's impossible to list all public health professions because they are all over the place. Public health director, that seems to be the top right there. And the low, median, and top salaries, these are based on years of experience. And the location, like a market, salary market, it depends. It will be in the South, it will be different from New England, it will be different from Northwest, it will be different from California. So these salaries are just like that. These are just selected figures that were found in the all over the United States. So second is that levels epidemiologists and biostatisticians, they could make as much as 123 or even more than that. Public health nurse, that is the range. It could be more than 105,000. It depends on the hospital, depends on the environment, the work, it depends on the city, and so on and so forth. So nutritionists, same thing. Nutritionists definitely can way go above 74,000. We're being cautiously presenting that number there. Health educators, in the first column, you see 0.25. Those are the lower percentiles, the lower 25% that you find in that category, salary category. So environmental health scientists, those people who take care of how clean a restaurant is, maybe how people do research on environmental science, and so they could go as high as 124,000. And those are the people in 10%. 10% are the top 10%. All right, my final comment, because I really have short time to stay on this. My final comment is that we have to know that public health profession exists in almost every area of human endeavor. And because public health is about population health, it's not just individual and the doctor. It has to be in the context of the society. It could be global health. So it is really very impossible to delineate, to separate public health and their subspecialties. For example, epidemiology as a public health profession has its own branches in the areas of you have a cancer epidemiologist, genetic, environmental, occupational epidemiologist, infectious disease, reproductive epidemiology, social epidemiology, and so many others. They are all still epidemiologists. In addition, it is pertinent, very important to know that any issue that is recognized and declared as a public health emergency, that requires basic public health etiquette, that is, to actualize disease or injury prevention, which is the actual focus of public health, to prevent disease and injury when it is possible. Leadership is really important, because if you must be ethically strong. You must raise your high ethical responsibility to resist unethical influences. In research, you have to make sure that you obey all these IRB, things like that. And then in business, you have to stand against all kinds of influences that may want to question your ethical standards. And in politics too, you have to stand your ground. You cannot allow politicians to tell you what to do, because then you are doing so at the detriment of the society. That is not allowed. Notable public health problems that we have worldwide, they include, which some people might not even know that they are connected with public health. They are actually connected with public health. These include gun violence, that's a public health emergency, intimate partner violence, domestic violence, genital mutilation, where they are still happening all over the world, all over. Not in the United States, but you go to a third world, most especially, is still widely practiced. So gender-based violence, that's everywhere. Traffic accidents, that's a public health emergency, especially when you're talking about fatalities, because when data comes, they come under public health too. Food safety, recalls, auto safety, recalls, all of which must be given public health attention, because they are all public health emergency. So that would be all for today. If any questions, I can take a couple of questions. I know I don't have a lot of time.
We'll go ahead and wait for, we'll do the Q&As after we talk to the panelists, okay? So
all right.
Look, I know for a fact, the incredible presentation, I know for a fact, you're going to get questions after that salary and wages slide, okay? So I know eyebrows were raised there. Even one-on-one sessions you'll have, okay?
No
so very good, excellent. And so what I want to actually move toward now is going to be the panel discussion. And before I actually get into it, guys, I want to just remind you again, let me share the, quickly, share the rules again. That don't worry if you've had questions, and I know somebody, I want to ask the question now. No worries, make sure you know what kind of questions you want to ask, and basically put it in the chat box. If you're in this WebEx meeting, basically just put it in the chat box Q. All right, so all you have to put is Q in, and then I'll basically see that in the chat box. If you're in the live stream, go ahead and just put your question in the chat box, and I'll take it then. But this is I'll actually receive those questions after we actually I give a few questions to the actual panelists. Okay, so that's going to be coming up soon. So don't worry, you'll get your questions in. All right.
Okay, sir.
Yeah, very good. So basically, I just wanted to remind you on that. Another thing is that you could definitely make sure the mics are muted. Just a reminder one more time, just so that because sometimes you may not know that you have other noise going on in your where you are sitting. Also, the video, you can turn that off as well. And again, we'll basically have our Q&A after we have our little discussion here. So I can't wait. It's an incredible panel. I know you guys are gonna be incredibly intrigued and inspired. So it's a one.
Dr. Downs?
And she's a former astronaut, okay? She's a retired U.S. Air Force colonel. She retired from the Air Force in January 2005 and from the National Aeronautics and Space Administration, NASA, in May 2006 after a 28-year distinguished career. Notably, she is a former military instructor and test pilot, the first woman pilot, and the first commander of a space shuttle. Colonel Collins began her STEM education at Corning Community College, earned an associate's degree in mathematics and science, a bachelor's degree in mathematics and economics from Syracuse University in 1978, where she was an Air Force ROTC distinguished graduate. And she also earned a master's of science degree in operations research from Stanford University in 1986 and a master's of arts degree in space systems management from Western University in 1989. Her Air Force pilot training began in 1979 at Vance Air Force's base in Oklahoma, which is where she got her start at T-38 pilot instructor. From 1983 to 1985, she was a C-141 aircraft commander and instructor pilot at Travis Air Force Base, California, and spent the following year as a student with the Air Force Institute of Technology. Her education continued to be an area of focus for Colonel Collins. For 3 years, 1986 to 1989, she was assigned to the U.S. Air Force Academy in Colorado, where she was an assistant professor in mathematics and a T-41 instructor pilot. After graduating from the Air Force Test Pilot School at Edwards Air Force Base, California, in 1990, she was selected by NASA and became an astronaut July 1991. Colonel Collins has logged more than 6,751 hours in 30 different types of aircraft and more than 872 hours in space as a veteran of 4 space flights. Okay, all right. I'm sorry, I guess I think that was it was something shared there, but okay, anyway. Sorry about that. I think Dr. Knight, I think that you are you sharing something now? Okay, let me make sure that's sorry about that.
It's Dr. Saeed.
Oh, that's Dr. Saeed. Okay. All right. I'm sorry about that. Okay. All right. All right. I'm sorry about that, guys. Something came up there. But okay. Sorry. Oh, here we are. Okay. I'm sorry about that. There was something that came down on my screen there, so I apologize. Okay. Well, let me, I don't think I can actually, I have access to my actual screen here. So let me just bear with me as I,
It's okay, Dr. Dance. Let's have Colonel Collins introduce herself, please, for 2 minutes.
okay.
Introduction, that's
Yes.
it's technical glitches. Thank you for your patience, everybody. So let's have Dr. Colonel Aline Collins. Please introduce yourself for 1 minute.
Yes. Hello. Would you like me to make an opening statement?
Yes, please.
Okay. Well, first of all, thank you for having me here. And I want to thank Dr. McCrary for the invitation. It's really great to be here and talk about one of the things I love very much, and that's STEM, science, technology, engineering, math, education, and careers, and how you can make the world a better place by your contributions. So I know I don't have like a formal presentation, but maybe I'll just take a minute or two to talk a little bit about my background. And I think, how did I get interested in science to begin with? Really from books and from my teachers in school. It was very, very simple. When I was young, I was very interested in biology and physics, which is the study of motion. I wasn't the smartest kid in the class. That's very important. I wanted to be a math teacher, but I think the best teachers are people that maybe struggled with a subject when they were younger, because to be a good teacher, you maybe understand where your students are struggling. So I wasn't the smartest student in my class in math, but I still wanted to be a math teacher. And that when I was in secondary school and even in college, that was my goal. And then opportunities started opening for women in the military. I wanted to be a pilot. And as a young child, I would watch airplanes take off from the local airport. In my hometown, we had a glider port, and I would watch gliders fly overhead. Maybe wonder what it would be like to be in an airplane. And so I started reading about pilots and airplanes, what makes airplanes fly. And I read about the history of aviation. And I decided to join the Air Force. And, maybe later when we, I don't want to take too much time, but maybe later when we get in the question and answer session, I can talk about some of the things that motivated me to become a pilot, and then some of the opportunities for you in the aviation field. There's opportunities to be pilots. And people focus on pilots because maybe they're the most visible, but there's also aircraft mechanics, air traffic controllers. There's aviation, like the regulators, like the Federal Aviation Administration. And all of these jobs are maybe not as visible as you would think, but they're still in need of I would say technical people and people with STEM backgrounds, because the aviation field is just going to continue to grow, and space is going to continue to grow. And in the future, there'll be more and more people going into space, whether for work as astronauts or maybe as tourists flying in space. And you're going to see the space field grow. So I'm looking forward to talking more about that. Thank you.
Okay, thank you everybody for the wonderful, thank you Colonel Collins for the wonderful introduction and the opening remarks. We really appreciate taking the time and coming and enlightening and educating our students. It was very insightful, good of you. So our host is a little bit having technical problems, so that's okay, we'll be patient. So he's going to log out and log in right now again. We're going to introduce Dr. Stacy Hobson. Dr. Stacy Hobson, could you please give us a 1 to 2 minutes remark about yourself, your background, introduce yourself to the participants, please.
Great, thank you so much. And I'm glad to be here all of you today. I am Stacy Hobson, a scientist at IBM Research, and I lead our new initiative around tech for racial and social justice. Just a little bit on my background, I have a Bachelor's of Science degree in computer science from a historically Black college and university in South Carolina State University. I have a Master of Science in computer science from Duke University, and a PhD in neuroscience and cognitive science from the University of Maryland. So started out with a computer science degree and then transitioned to focus on science and how people think and understanding how the brain works, to leverage that knowledge to help drive more, help drive technologies that really help people with the work that they do and take into account how people think and how people interact. As a means to make technology better for our use. So in research, it's an exciting place to be. I've focused on trustworthy AI, so AI and the need for fairness, the need for transparency, and ensuring that the technologies that are being created and used really take into account diverse communities and diverse people and will not harm others. So I'm very passionate about, diversity, inclusion, fairness in technology, trustworthiness of technology. And I'll tell you more as we get to the Q&A portion of the panel, but I'm definitely glad to be here.
Okay, excellent. So wonderful introduction, Dr. Stacy Hobson. Thank you so much. And we are so happy to have you on board as our panelist. I really appreciate you coming today. So I think I skipped the order. Oh, wow, our host is back. Good.
Okay. I think I'm okay now. I do apologize because of the technical difficulties here. But yeah. I think we're okay now. I really do apologize for that. I'd like to actually introduce now, that is Dr. Knight. Okay. Matilda Knight, she's associate professor in the Division of Biology at the University of District of Columbia. Also an adjunct professor at GW, George Washington University, in the Department of Microbiology, Immunology, and Tropical Medicine, where she collaborates with Dr. Paul Brindley on developing tools to genetically transform the snail host. Early on, Dr. Knight realized that her research interests would reflect the needs of those in her community. Because of her upbringing in Africa, Dr. Knight was born in Ghana. She decided to work on parasitic diseases to solve the problems of persistent and chronic morbidity and death from tropical diseases. In fact, that's why she actually went to NIH to actually find vaccination for schistosomiasis. She received her Bachelor's of Science at King's College at the University of London and continued her education earning a PhD in biochemistry. Her scholarly research has been conducted in premier laboratories such as Medical Research Council Research Institute and the National Institute of Medical Research in Mill, London, now called Francis Crick Institute, commonly known as the Crick. Dr. Knight was the first to use complementary DNA libraries for the cloning and identification of major antigens of schistosomes. In fact, her groundbreaking work in schistosome research was considered to be a major groundbreaker in nuclear chromosome research. Dr. Knight came to NIH to work on molecular vaccines for schistosomiasis. Her research yields lasting solutions that will help alleviate schistosomiasis. She's basically a scientist, scholar, educator, and a grandma. And please present Matilda, Dr. Matilda Knight. She likes to be called Maddie. Everybody can call her Maddie. All right.
That's
everybody welcome.
That's
Dr.
correct. Yes, most people know me by Matty. It's all right, but thank you for inviting me. And Dr. Mccrary, thank you very much for the phone call to invite me here. And thank you for that introduction, Dr. Downs. And Dr. Saeed, thank you very much for the invitation as well. And I'm very pleased to be here. And I actually, going through the list of participants, I see a lot of my students here. I'm supposed to be teaching a class right now, but I told them to head this way so I can see their names popping up in the list. So I'm pleased to see them all here. And as Dr. Downs said, I am basically an immunologist, broadly speaking, with this concentration in parasites and viruses. And I trained in the UK. I'm born in Africa, raised in Africa, went to school in Africa. I did my secondary education in Africa and moved to the UK to do what's known as A-levels, and went to university, what we say uni, in the UK. And then went on to do my PhD in biochemistry, King's College, and also in the Department of Biochemistry, where Rosalind Franklin actually worked. And so it was fun to just be lingering in the place where she actually had coffee in the dark room. Then I proceeded to work on parasites because I felt it was pretty much related to where I was coming from. Parasitic diseases affect huge population. We talked about public health here. In Africa, public health means worms, a lot of worm infections. Well, there are all the other infectious diseases, but worms are really a huge problem. And until I showed up in the UK, I did not know specifically which branch of science I was going into. I was always interested in science. I somehow found myself in doing a lot of science in high school. I had wonderful teachers who encouraged every bit of it. Anything silly was good. And there's a memory I have, and I have shared when I was around my early teens, of starting a science club in the high school. It was an all-girls high school. So we were never intimidated by having boys around. And I think boys being that kind of, that distraction did not happen in my existence at all. And then went on to work more in schistosomiasis. And I think what happened was I was working in viruses. My PhD was in encephalomyocarditis viruses in HeLa cells. And molecular biology was just beginning to break out. They were just learning about how to isolate nucleic acids. And I happened to be right there in that basement floor of learning all this technology. So I went into schistosomiasis because I knew I could bring this technology to this old problem of finding solutions to all these worms that existed in children, especially in Africa. And the worm infections today are known as neglected tropical diseases, and they are. Schistosomiasis is second only to malaria. It affects 250 million people, second only to malaria. 600 million people are exposed to it. It's mainly a disease of poverty and poor drinking water, poor sanitation. And unfortunately, there's only one cure for this. It does not cure the adult worm that lives in your body. It can live for up to 30 years in your body. So people who are chronically infected really have a very difficult life, and there's no remedy. So I went into the vaccine world, and I was the first to take cloning, molecular cloning into schistosome antigens, into trying to produce a vaccine. So I got a phone call in the spring of '87 from Alan Sher, Dr. Alan Sher, who is PI at NIH. And he called me and he said, can you come? I need somebody to work on this antigen and blah, blah, blah. So I literally said no on the phone. I said, no, I have 2 children. I don't know how to uproot and come to America. And basically, I just left it. I shared it with my husband and we forgot about it. And then in June, I got that phone call again. And he said, I've interviewed whatever, you are the only one I want. So I came to NIH and I thought, you know what? He said, come to NIH. You don't have to be here forever. So we decided we'll do 2 years. We came in '87 and we decided to stay for 2 years. And he was a medical doctor. He's a hematologist, oncologist, and he was what you call an attending. He was a consultant. How is he going to move his profession to America? And that was a challenge. So I came first and stayed for 6 months working alone with the kids at NIH, which was just difficult. My mom came to help me. And slowly but surely, he found his way here 6 months later. So I was a single parent for a little bit and juggling. That's what we do. We juggle. and in the end, basically stayed, and for no other reason than the weather. The weather is better here. And career-wise, I have kind of zigzagged my way along the path like most people do. And now I'm at UDC. I'm in the classroom. I have students in various places in different classes, and also conduct active research with the students. And I also supervise PhD students from Howard. It's a collaboration, and one of them, literally Michael, who is an alum, UDC alum, just got his PhD in May this year. And I have another one in the wings. And so I've made her a promise I'll see her through. So thank you, and thank you for the invitation. And there's more in that bio. It's a little long, but thank you.
Yes, definitely make reference to her bio. It's incredible what she's done all these years. I'm going to introduce our next panelist. I just, after you, if you guys could restrict your actual comments to about 1 or 2 minutes, if you could, just so we can get to everyone. Let's talk about now. That's Dr. Michelle Antoine, and she's a member of the principal professional staff at the Johns Hopkins University Applied Physics Laboratory. She is the program manager of the Surveillance Systems Program in the Special Operations Mission Area of the Asymmetric Operations Sector, where she conceives of, plans for, and manages the execution of cutting-edge technology solutions to meet both immediate and emerging operational needs of the nation's warfighters. Dr. Antoine's work spans a breadth of technologies, including RF communications, electro-optics, computer engineering, biology, chemistry, and material science. Dr. Antoine says her high school chemistry teacher is mainly responsible for her interest in chemistry, as she loved being in class on days of experiments, and that the hands-on lab work was exciting and fun. She also states that her mother steered her towards engineering. She had no idea what an engineer was at the time, but knew she was good at math and enjoyed science classes. She is a staunch supporter of encouraging the younger generation, especially girls and minorities, to study STEM fields. Dr. Antoine loves engineering, but she also loves sports. Another unique fact about her is that she has a massive garden that currently resembles a pepper farm. Dr. Miguel Antoine, please welcome. You are part of our distinguished panel. Right?
Thank you for that nice introduction, and thank you for the opportunity to participate in the discussion today in the panel. Just being on the panel with these other panelists is really very humbling. I would say that it was never my desire to get a PhD in chemistry, and it was through encouragement and mentors, really why I'm here today. And that's really what I want to stress to others, is that I feel like if I'm here and I can do this, anyone can. I was really encouraged through my chair at Hampton University, which is where I got a master's in chemistry. He is the one who really encouraged me to continue my education. As I said, a PhD was not in my plan. Even a master's degree wasn't in my plan. But it was, I felt like I needed to learn more in order to do the job effectively. But it was those professors who encouraged me to continue and said, we need you and you can do it. Without their encouragement, I'm sure I would not be here today. In addition, Dr. Mccrary at UDC now, who was previously here at the Applied Physics Laboratory, who also provided me a lot of encouragement, a lot of assistance, and gave me additional confidence that I can do this. So that's really one of the reasons why I am a staunch supporter of encouraging not just girls, minorities, but all to pursue fields in science, because we don't get that encouragement as we, are matriculating through the schools, unless you have someone who's willing to, reach out and look out for you. So that's really my goal here, is to let others know that you're not in this by yourself, that you do have to reach out, but there are others that are willing to help you. And so we can talk more about that as we continue.
Well, thank you so much, Dr. Antoine. Thank you so much. Let's move on to Ms. Adrian Wilson. And she is a graduate of Tennessee State University with a Bachelor's of Science in Mechanical Engineering. and Tuskegee University with a Master's of Science in Electrical Engineering. Ms. Wilson is a licensed professional engineer in the state of Indiana and currently the senior facility planner for the Joint Task Force in Guantanamo Bay, Cuba. As a member of the Joint Task Force Engineering Directorate, she provides program management oversight of all military construction and construction-related activities for the Joint Task Force. Prior to joining the Joint Task Force, Wilson was a facilities engineer with the Naval Service Warfare Center Crane Division, where she provided planning and execution support for 128 structures and test facilities for the Specialized Munitions Division. This was accomplished through project management, strategic planning, engineering design, and modernization of current building systems. Ms. Wilson was one of the first females to deploy to Afghanistan in support of the USACOM Mobile Technology and Repair Complex. While deployed, she managed over 800 construction, repair, maintenance, and modification projects through all stages of planning, design, and execution in support of the Special Operations Forces, utilizing a wide array of tools and skills: carpentry, welding, CAD design, 3D printing, sewing, thermoplastics fabrication, and weapons repair. It was because of a summer robotics camp that sparked her interest in STEM, and it is no surprise that planning, designing, and executing projects to enhance everyday lives extends beyond Dr. Wilson's day-to-day work as an engineer, as Dr. Wilson also enjoys working on various home improvement projects in her spare time. It's a pleasure to meet you, Miss Adrian Wilson. Welcome.
Thank you so much for that introduction, Dr. Downs, and I thank you for everyone for having me here. I look forward to expounding on my experiences through our panel discussion this afternoon.
Excellent. Right. Okay, guys. I think that we have pretty much everyone now. So let's go ahead and get started with a first set of questions there for everyone, okay? So again, just to remind everyone, everything's going to be open for questions for everyone. So if you've sent a question and we haven't addressed it yet, no worries. We'll get to it after the actual panel discussion, okay? And just put a Q next to it if you're in the WebEx, and then I'll basically repeat your question, okay? Thank you. All right, let's go ahead and go through our questions now. And let's see. Okay, first question, Colonel Collins. How has the field of space science changed over the years?
Hi, well, thanks for the question. How has space science changed over the years? The first thing that comes to mind is the fact that, you think space science, you think astronomy. You think about cosmology, which is the study of the origin and the destination of the universe, and what is our place in this universe, and also planetary science. Can we live on Mars someday? So obviously it's changed a lot because of all the technologies. The number one being telescopes have gone into space. So back in the old days, our telescopes were only on the surface of the Earth, and we had the atmosphere was restricting all that we could see. So now we have the Hubble Space Telescope, and soon the James Webb Space Telescope next year, which will allow us to see even farther into the universe and farther back in time, and teach us more about the universe that we live in. We also have the Chandra Observatory. I've got the poster here behind me. It does X-ray astronomy. And the Kepler and TESS satellites, this one is really amazing because the purpose of these satellites is to find Earth-like planets elsewhere in our galaxy. So that's the biggest reason I think that space science has changed. Also, I think on more personal level, we see more and more women entering these fields. Whereas, back in the old days, maybe women might have been a little discouraged because the culture was not really, maybe we didn't feel like we were accepted into the culture, whether it was, the flying side, for me, pilot, astronaut, or the science side or the researching side. It's not true today. We're all here. We are all here because we want you to follow in our footsteps and do these great careers in STEM. Thank you.
Thank you so much, Colonel Collins. Thank you. So exciting to have Astronaut on the panel here. Dr. Knight, I know that we've already had some presentations, incredible ones on careers, but from your view, what's your take on how biological careers have evolved up at this point?
Well, I can say it's become more technical. It's all right. You have to have the theoretical background and you have to have that instruction, in-class instruction. But at the end of the day, I think it's become much more technical. So skill sets are very relevant. And as you all know, the whole molecular technology, biotechnology has mushroomed. I call it the industrial revolution of our current industrial revolution. It's in biology, but it's in commercial biology, it's in technology, and that is the main change. That's what I have seen progressing. It's gone more and more technical.
Okay. Excellent, thank you. Dr. Stacy Hobson, AI, artificial intelligence. Basically, we hear a lot about artificial intelligence, Dr. Hobson, and use of AI in our society. Why is there so much focus on AI, and how is this relevant to me as an individual?
AI is an advancement of technology, and I appreciate that both our previous panelists, Eileen and Matilda, Maddie, talked about technology and how it impacts the work that they do. So for me, I focused on a career in technology and computer science, and then recently I focused more on AI. And AI is pervasive. We interact with AI systems every single day. I know a bunch of us our free time watch Netflix. Well, behind the scenes of Netflix is this advanced recommendation system. So the Netflix platform is actually analyzing the movies that you watch to tailor personalized content and personalized recommendations to you. They actually even learn from the movies that people watch to create their own programming, their own shows and their own movies. So when you see that Netflix, original series or Netflix original movie, they've learned from the content that millions of us watch every day and say, people like these particular aspects, or this is what people tend to resonate with when it comes to movies or content or media and so on. So that's just one example. When we think about cars and my car now, if a car stops in front of me, my car will stop automatically. So just the advancements in driving or even self-driving cars or going to McDonald's, like in ordering food from McDonald's. I actually don't go there very much, but some of you probably do. There's actually AI and learning systems beyond that. We see what people order and how do we tailor new, or how do they tailor new food concepts or meal offerings based off of understanding people's preferences and their taste preferences and so on. So, AI is everywhere. And it's really, really critical that we ensure that AI is fair, that we mitigate biases, and that AI is not harmful to people of specific communities. And that's where my passion lies. And that's really around the work that I do right now. Excellent.
Excellent. Thank you so much, Dr. Hobson. Dr. Antoine, as it relates to you being an engineer, you've been basically an engineer in the industry and you've been an engineer in academia. Could you expound upon the major differences in each sector?
Yes, I will. And so just to give a little bit more clarity, so I work at Johns Hopkins Applied Physics Lab. And so we are a universally affiliated research laboratory, and so we're a nonprofit. And so we are part of the university system, but like I said, we're also a separate laboratory. And the main difference is at a university level, in terms of research, you're really working on basic research, right? You're writing a lot of grants, and you're really trying to say, what's that next thing that I can innovate or that I can develop? When you're in an industry, you're looking at profit. It's the bottom line for that company. They're really about, we're going to develop new capabilities, but it's all about how is that going to help us make money. Being here at the laboratory, at Johns Hopkins Applied Physics Laboratory, we actually take both of those and combine them such that we really want to develop the next capability to solve our nation's most critical challenges, and we do that without thinking about the bottom line. We do that thinking about what's that problem we're trying to solve, and let's put those best minds and capabilities behind that such that we can solve it with the best solutions possible. And so that's really the main difference, is that we're not thinking about the profit. We really are concerned about solving that problem, building that technology, and bringing in those most innovative minds to give us the edge in doing that.
Thank you so much, Doctor. And so basically, how about Ms. Wilson now? Ms. Wilson, as far as our young STEM, people who are very interested in STEM careers and they're very, very young, what's your take on that importance of mentoring young women interested in STEM disciplines?
Mentoring is very important because if someone can see it, then they know they can be it. It's very intimidating to walk into a room with nobody who looks like you. You don't know how to act, like different things you're supposed to do. For my personal experience, my first internship with the U.S. Army Corps of Engineers in South Korea. And I was fortunate to have a Black female engineer to be my mentor over there. And it was just inspiring, motivating to see her walk into a room with other people that do not look like us and just carry on, take care of business how she's supposed to. And also it helps, I always think of lifting as we climb. As women, female, Black engineers move up in the world, there's no sense in recreating the wheel. We have to reach back, help each other. Trial and error, some people do things right, teach people, young women, to make sure they don't make those same mistakes so they can progress further in their careers.
Thank you so much. I guess we can head back on our next round here to Colonel Collins again. And Colonel Collins, when the average person thinks of physics, they think of floating in space, astronomy, and walking on the moon. How can physics be applied to everyday life?
Yeah, thanks for the question. I think sometimes people think physics and they're like, whoa, it's it seems a little bit maybe intimidating, but physics is the study of motion, it's the study of light, electricity, magnetism, and more. And it is obviously around us every day. I mean, everything from how we walk, how we drive a car, talking on the phone, how those waves, things that you cannot see, like the electromagnetic spectrum, things that exist, but we can't actually see them, but we have scientific proof that they exist. And if you think back to Dr. Olanai's talk on the health industry, there's things that we use to evaluate our health that are totally based on physics. Like we get x-rays, we have the MRIs, which is magnetic resonance imaging, ultrasounds, we have laser surgery that helps us see better. All of these things are based on physics. And the thing that I find very exciting is there's so much that we don't know yet. And there are so many medical advances that are left to be made. And there's so many, medical devices that are left to be invented. And we need physicists and engineers and researchers to help us develop these devices to make, really it's to make the world a better place. And a lot of people ask, why do we go into space? Well, we go into space for a lot of reasons, but I think many of the things that were developed for spaceflight are used back here on Earth, especially in the health industry. And one last comment that Dr. Hobson made me think of this when she was talking about AI. I forgot to mention data scientists and how important it is that we have people choose careers in data, which you don't normally think of that. But I would say people with math degrees or statistics, we need data scientists because to do artificial intelligence and to do even astronomy or the research of the future, we need to manage large amounts of data, and we need people that know how to do that. So that I want to add that to my previous question. Thank you.
Thank you, Colonel. Thank you so much. Maddie, how about you now with basically As an immigrant to the United States, can you describe some hardships or disadvantages that immigrants seeking an education in the medical profession or other allied health fields may encounter that U.S.-born citizens may not have to face?
In my case, I can only speak from, I can look at it broadly in our case, myself and my husband's case, my late husband. We were very lucky because NIH is an institution with a very big international influence. And when you're an immigrant, community is important. That sense of belonging is extremely important because it kind of anchors you to a place. And so for us, NIH was the place where we met as newcomers. We met our new friends in this new country, and you find you have a lot in common. The one thing in my case is there were not many not many women at all, and not many women who looked like me of color. And in LPD, there was only one, aside from me, there was Dr. Isabella Kwachi, who worked in malaria. It was just the two of us. And I remember mentioning this to one of the postdocs in the lab, because it was very disappointing in that we'd heard all of this about America, civil rights movement, everything when you're on the outside. And then when you come on the inside, you realize that, oh my gosh, they talk about civil rights, but actually it's not the reality. The reality is still very, very stratified. And so you found, and I mentioned this to Ed Pierce in the lab, and Ed said, have you noticed it? And I said, of course I've noticed it. So you have the stratification of the people in the cafeteria serving the lunches and the sandwiches, African-American, or the janitors, the janitorial staff, African-American. And that really, really bothered me a lot. And it bothered me for a very, very long time. And then I asked myself, where are the African-Americans here in science, doing science in these laboratories that are federally funded? And that really bothered me. So at the end of the day, I think we have to, from where we are sitting now in a school like UDC, we have to do our very best with this generation that's coming up to emphasize that Dr. Mccrary just said, the country needs them. You cannot compete at all when you are ignoring a major section of your population. And this was a huge issue for me. I'm here at UDC for one reason and one reason alone, is to pass the torch, do my best as I can. Because honestly, the dearth of minorities is bad, but we're talking female in the STEM is awful. So that's the name.
Well said. Thank you so much, Dr. Knight. Well said. Dr. Hobson, young woman of color, why should you pursue a career in computer science?
I think Dr. Knight touched on this in some of her comments, but I'll follow up on that as well, or I'll expand on it as well. I think we all have all of us as panelists, if you're determined and you work hard and you focus on what you want to do, you can be on this panel 10 years from now, 15 years from now, talking about your experiences as an astronaut, your experiences, working in the NIH and being, a well-known person in your field, or your experiences in being an engineer or so on. So I wouldn't say that I am unique in the sense that I'm different from anyone else, but it's more of, I decided that I wanted to go get a PhD. I wanted to be at the top of my field. And I loved math. I loved science. I loved computer science. And so I said, this is what I want to do. And this is where I want to, build a career out of. And I want to say to everyone on this panel, or everyone watching, you can do whatever you want to be as well. And I think there's this critical need in computer science, or even as Eileen talked a bit as well, like data science, math, sciences, and so on. The purpose of this panel is to talk about STEM and talk about how we need all of you to focus on STEM careers, to be the next generation, to be the panelists or be the people that are really at the forefront in driving advancement, driving inclusion, and driving just the work that we do in this space. So my last point here is that if we all can do it, you all can do it. There's no difference between us and you all. It's just a bit of determination, working hard. When you fall down, you get up, you dust yourself off, and you keep going. And I believe that every single one of you watching today can take the same paths that we did. Find your passion and pursue it.
Well said. And on that note, Dr. Antoine, since math is a part of this process, how do we demystify that belief that math is so difficult?
And before I go there, I just want to piggyback to what Dr. Hobson was saying, and that diversity of thought is so important, especially as we, innovate, because it helps us, tackle these problems much faster. It helps bring, more diverse minds into that thought process of how do we tackle this engineering challenge. Prior to that, you're only going to have this one way of thinking. You're only going to have input from this one community, but that's not going to help you solve that problem. When you have diversity of thought and bringing in input from women, from minorities, from younger generations, then you're able to look at different ways of tackling that problem, and then you may be able to do it sooner, cheaper, and more efficiently, right? And have a better product at the end. So it really is important that we consider input from everyone, because everyone has value, and their thoughts have value, and we can always build, and develop better when we include, thoughts from everyone. In terms of math and demystifying math, my grandfather was a math teacher. I come from a family of teachers, and so teaching is really what's really important in terms of demystifying math. You have to have a strong teacher who's willing to put in that extra work and ensure that you can learn those concepts. Some teachers just divvy it out and say, go with it. However, you have to, have that wherewithal to say, please help explain this to me. Ask those questions, and then get help. Form study groups. Don't just rely, on a book and yourself. And you got to get help. So it's not that math is hard. It's how it's taught, perhaps, is not the best way for everyone to learn it. And so you have to reach out and perhaps, have others come and help you there, but also have your teachers, perhaps change their teaching methods such that they can reach out and teach diverse populations a little bit better as well.
Thank you so much, Doctor. Ms. Wilson, after we've conquered that math now, could you actually talk about some careers in electrical engineering? I know you also had a mechanical part there too, but in the electrical engineering, any career?
Of course, to piggyback off of what Dr. Hobson said, you can literally do anything you want to do with electrical engineering. If you think about it, electricity is involved in every single piece of our everyday life. So cell phones, computers, spaceships, satellites, buildings, anything you want to do. So the only thing you have to do is have a passion to just create. As an engineer, there are certain steps you have to do in order to get an engineering degree, go to school, XYZ, but other than that, there is no blueprint. You're an engineer, you create the box. You do not have to fit inside of a particular box that was the status quo created. So with electrical engineering, the door is wide open from facilities, manufacturing, education, the medical field. It's just in anything you can think about doing, you can pursue and turn that into something.
Thank you so much. Thank you, guys. I think we have to open up to the, we have quite a bit of questions I have in the chat box. I figured that. So let's move to that. I want to remind you again, just remain muted, and then I'll let you know, I'll call on you as far as what your question is. And then you can be unmuted, just that one person, just so that it's not too much noise going on. All right. So let's take a peek here and let's see. we definitely have a question. This is a question for Adrian Wilson, Miss Adrian Wilson. And this is from Alcana Padea. I believe that's Padea. I'm sorry. And it's, how did you find motivation while pursuing a variety of careers?
How do I find motivation? Well, I have to eat, so I have to work to eat. Besides that, it's just working in facilities. I get to create a lot of things, so it's very satisfying to see something that's on paper turn into an actual physical building how you imagine it. It's just so amazing to see people work together as a team to create something that didn't exist before, to improve living conditions, to improve working conditions for. And with facilities, that really, it's a good mood booster. If you think about it, I always say a facility engineer is like one of the most important careers. As you're sitting in your office in your home, if the HVAC went out, who's the first person you're gonna call? It wouldn't be comfortable. If the lights went out, who are you gonna call? So to be able to create a comfortable work environment for people to thrive in, to be able to help people in that area, that's what gets me up in the morning and keeps me going.
Excellent. We actually have another question here, and in fact, Cornelius Andrews. If you can unmute now, you can ask your question, Cornelius. Cornelius Andrews. Okay, well, maybe you stepped out for a second. Maybe, I don't know. Well, let's move on to, and I'll come back to you, Cornelius, if lady, you can be unmuted. How about Kyra Thomas Nelson? You can unmute and ask your...
Yes, hi. I'm actually former military, so seeing military members on the panel is actually pretty cool. I actually have a few questions for them. What do you recommend for somebody in the STEM field coming out of the military with minimal STEM experience? And like my experience in the military was welding. That's basically all I did for 6.5 years. So what recommendations do you have for people who want to maybe get into the STEM field who have minimal experience in that field previously?
Who wants to take this one? Because we have a few here.
Oh,
who would like to take that question?
For either Colonel Collins or
okay. How about
Ms. Wilson?
And we could do that. We could do one and then the second one. How about Colonel Collins? You have to take one.
Oh, okay, I'll give a short answer. I would say, first of all, look at the first of all, welding is great because the space industry needs welders. I mean, you could apply to one of the aerospace companies. But on the other hand, if you want to improve your education, I would say look at community college, look at university, but look at the GI Bill. And there's so many educational opportunities for veterans. Definitely take a look at that. And aerospace industry needs you. Thanks.
Okay. Ms. Wilson, did you want to add?
So I'm not former military, but I have been working with the DoD since I graduated from school. My first advice would be definitely hop on the USA Jobs, look for technician positions just to get your foot in the door. Especially being a veteran, you get veteran preferences and it adds points to where you're looked at over other candidates. And then once you get your foot into the door, once you get into the government, it's so easy to branch out, try different things, to see what you like, what you don't like. And they also actually pay for my master's degree for me to continue going to school and further my education. So there's many opportunities on the government side, especially for former service members.
Excellent. Okay. I wonder if is Cornelius there any again, or Cornelius, can you unmute or know if you came back or not? How about Orlando Chandler? Orlando Chandler, you want to unmute now? Ask your question.
Hi, specifically for Mr. Victor Mccrary. If there's do you think that the way that funding is allocated to the District of Columbia will change in a way that we can leverage it positively to get more students of color into STEM programs if statehood is achieved?
Let me just answer that to say that I think what we're doing is you are our best representatives to go to the city council, to the mayor's office, and obviously the federal government in showing that as more students come out and are filling the jobs in the DMV region and particularly within the district, that they can see that UDC is a value proposition, bringing a value proposition to the community. We just had an economic impact study done here at UDC, and we found out that for every dollar that the district gives us, we return $4 back in economic impact. To put that in numbers, over the past 2 years, the University of District of Columbia has had a $400 million impact on the community in terms of jobs and things like that. So all I would ask you to do is, first of all, tell your colleagues and friends to, if they're looking for careers and what you've heard from the members of this panel, to pursue your careers in education through the University of the District of Columbia, whether it's at workforce development at the community college level or the 4-year or graduate level. And then when you go out to these employers, because as you see from all these participants, none of them have Rockefeller in their last name. All of these folks here had to start probably at -10, -20, like many of us had to do, but they went on and accomplished themselves. And I would ask, as either a student or as a former student, when you go out to your employer, that they can see that UDC is a good investment.
Excellent. All right. So basically, I want to ask if Tawana is in the WebEx or if that's sent through live. Is Tawana here and she can unmute?
Yes, I'm here, Professor.
Okay, you want to go ahead and ask your question?
I wanted to know, how did mortuary science help you all in your field, or if it ties in?
Does any panelist want to take that as far as mortuary science, how that could relate to any of your fields or anything? Or maybe someone that's here already, Dr. Yusuf, about mortuary science at all? I know this is a student, so she just wants to see what's the tie in there.
That's fine. That's fine. As an acting director right now, and taking care of the mortuary and going through accreditation, I've found out a lot about it over the last 5 years, as well as Dr. Saeed, as both of us have gone through the accreditation. It is a very historic field. A lot of people do not know enough about it. But for an associate's degree, the potential out there for not only the job market, but to make a lot of money it astounded me. It is very tightly regulated by ABFSE. And DC right now is in, I mean, there are a few funeral homes that are sort of controlling the funeral service industry, but DC is very diverse, and there's plenty of opportunity to gain not only a wealth of employment, but also experience. The entire country actually is also in that realm. So you're going to see a bunch of businesses, and especially a conglomerate of businesses open up, but the diversity in that business is not there yet. Our university right now is fully accredited. We are accepting applications, and I see a lot of people asking questions about it. And a lot of people are like are a little withdrawn about it because like embalming and all that. But just like any science field, there's a lot of there is a lot of underlying math, a lot of underlying science that we learn about it. But the second half of it is something I didn't really know about. It's funeral directing. It's talking to people. It's being a people person and taking care of families who are bereaved, who are grieving. Some of these families are expected, and we know grandma and grandpa, and they're passing away. But sometimes it's unexpected, and now they're in shock that they're burying a loved one that you didn't expect to die so soon. So as a funeral director, there's a lot of psychology of grief that they have to go through, and not to manipulate the person to buying things they really don't want. It's a very caring industry. And as I got to see many funeral homes, got to know a lot of regulations, it really is a field that I think a lot of students, many students, should be looking into. It is a science industry. It is a healthcare industry. It is a lot of things molded in together. Thankfully, in our current 2-year classes, our first year and our second year, a lot of diversity in our class, a lot of women in our classes. I'm very, very happy with that. And they're doing well right now. They're obviously getting, the seniors are getting ready for their national board exams next semester, but I'm very glad and pleased. And if anyone wants to ask any subject about mortuary science, me and Dr. Saeed are really ready for it.
Thank you so much, Dr. Yusuf. We have so many questions piling up here, so I just want to let's get to some more here. We have Courtney Hicks. You can unmute now.
Hello. My question just was, what books would you recommend?
Oh, and who wants to take it?
Oh, okay. I don't know if you saw, I'm actually answering some of the questions in chat. So if you posted a question, I am posting responses to some people. So I did post something there. I love fiction. I read a book by Tomi Adeyemi, The Children of Blood and Bone. It's definitely fiction. So I know some people are, really like nonfiction. But for those of you who like Harry Potter, it's sort of, actually, no, I shouldn't say that because that's what my friend told me. Then I was upset when I read the book. So anyway, it's it's sort of this like fantasy based off of a Black community that has a strong kind of ethnic background, and so she touches on topics of race and identity and colorism and things that I identify with even as an adult, but she writes it at a young adult book level, so it's still fun and it's still like fantasy and interesting. So I would highly suggest that you all read that if you're looking for something fun and in the sci-fi kind of fantasy realm. It's a trilogy. She's only written 2 books, so I'm a little mad at her that I'm waiting on the 3rd, but I would suggest you check it out, and I did post it higher up in the chat if you're interested in seeing that book.
And thanks for posting that, Dr. Hobson. Appreciate that help. And how about Oluwatomi for Dr. For Maddie, right? Do you want to unmute now, Oluwatomi? Oluwatomi? Okay, maybe.
I'm sorry, I missed the question.
Oluwatomi, you had a question, right, for Dr. Knight? Oluwatomi? Okay. I think that it's written here where it says, did having credentials and degrees from the UK stunt your progress in any way? Dr. Knight?
Actually, no, because like I said, I was very lucky that I was coming from institutions that were well known. Over here at the NIH, recognized the National Institute of Medical Research, NAMRI, which is now part of the CRIC. The CRIC is like the most renowned research institution in the UK. So saying that you're coming from the CRIC, people at NIH actually knew it. So I was fortunate in that, and as was my late husband. He was coming from University of Cambridge. So those are institutions that are well recognized. But I have also worked myself as when you have degrees coming from other institutions less well known. Personally, just within my experience, they tend not to hire them even to begin with. If you're coming from a less well known institution, your chances of getting into any of these entry-level jobs are kind of difficult. However, I have noticed a lot of Chinese on the campus at NIH. So I don't know where they're coming from and which institutions in China, but there are a lot more postdocs coming from China, coming from Singapore, coming from, I would say, the Pacific in general, Thailand, not so much coming from Africa, but which honestly, I don't know why the Pacific, but that's where they're coming from. And if you go to the NIH now and see postdocs in the labs, they're mostly from the Pacific. And as Dr. McCrary said, China is kind of aggressive about becoming the world #1 in research and development. They're very aggressive about it. And they're sending their young people to all these institutions all around the world. And they go back and take whatever they learn here, amplify it, develop it, and it becomes what it is. So I think for a long time, America has been asleep at the switch in terms of where we go, train our own people, encourage them, support them. And it's very, very rare you find a homegrown American at the bench in a place like NIH. A lot of them are international. And that's why for me, it was very easy to just fit in because it's a very international community. However, it's to the detriment of America because America needs to train its own. For some reason, it hasn't. And maybe it's time to pay the piper. Start training your people.
Thank you so much, Dr. Knight. We have another one to squeeze in here, a question from Natalia Gill. Can you unmute, Natalia Gill?
Hi, good morning, afternoon now.
Afternoon now.
So it's always 5 p.m. somewhere. I was gonna ask, I don't know if anybody mentioned it, but I want to go into emergency medicine or work in the ED as a nurse, or hopefully become a doctor in emergency medicine. And I was just wondering how we're in a current environment using AI in medical fields, but I just want to know the impact of like what is being done now in emergency medicine by like AI. I know a little bit, but I don't know much about it. But I just wanted to know like what the impact of AI is in emergency medicine.
I can take that one. Yes, so I was actually reading a research publication recently around the use of AI algorithms to prioritize which patients get care. So basically, this is sort of this like scoring, methodology that's used. So as patients come into, a hospital and you input the initial information, it may not necessarily just be in an emergency setting, but just in regular hospital care. Certain systems kind of say, okay, based off of this criteria and the person's symptoms and their particular statistics around like, their heart rate, prior conditions and so on, here's, who should be given care first. So that's just one example, but here's the alternate side of that and why I keep going back to the need for fairness and inclusion in technology. What the study pointed out was that for most cases, people in the Black community, so Black patients, were given a lower score for the same symptoms and the same underlying conditions as white patients were given. And so they were not able to get the same level of care or be prioritized as high. So that's a problem. So basically in this particular case, they were using the system to say, okay, this person gets care first because they're sicker or they need more care. But using details on the person's background and actually what the underlying, kind of like mechanism was used was the amount of money that was spent on care was used as a factor to indicate how sick a person was. And because, whatever insurance data sets they were using showed that people in the Black community spent less money on care, they were being prioritized lower. So this is a huge, huge issue. And there were other studies kind of showing that things like care for for mothers giving birth, just like algorithms that are assessing, like, or analytics that are assessing care in hospitals, that, if you're a Black mother, you're 5 times more likely to have adverse or negative outcomes during the birth process. Or there was another, study showing that recently, that if you're a Black parent and you have a child and your pediatrician is not Black, that it's more likely that your child would not get the care or be recommended to get help when they have certain conditions. Now, I'm not saying that you should go out and change your pediatrician. My pediatrician isn't Black, but she's amazing. I love her. But just kind of reading all these studies, it shows us that AI can be used in ways to really help, in the health setting, in the healthcare setting. But if it's not inclusive and it's not designed in a way that's fair, it can actually really, really harm people in certain communities. I have a lot more I could say there, but I know we don't have a lot of time, so I will yield to the next question.
Let's get this last question in for Colonel Collins. That would be Ayub Machtahi. Ayub Machtahi, I believe that's the pronunciation.
Ayub Machtahi.
You're there? Okay, thank you.
So I am math major at UDC, and I was all the time passionate about to become an astronaut at NASA, but it was hard since I'm from Morocco. So my question to you is, so how can I become an astronaut there, and what is the challenges that will be facing me in the future, and what kind of math do I need to pursue my future there? Thank you.
Okay, sorry, I had to unmute. So if I understood the question, you were asking about becoming an astronaut. Is that correct?
Right. Yes.
Okay. Well, there's so much I could say here. Just try to narrow it down. First of all, thank you for your interest in becoming an astronaut. Don't ever cut yourself short. When I was young, I thought, oh, I could never be an astronaut. They're just, they all live on this lofty mountain somewhere and they're all perfect. Well, astronauts are people, and we just have the skills that are needed for the space program. So for those who are interested in becoming an astronaut, look at the skill set that is needed. The astronaut corps is very diverse. We're even a very international program, but the skills needed for the future are problem-solving skills. That's why we like engineers. Engineers know how to solve problems. Actually, mathematicians solve problems, and scientists using the scientific method solve problems. So that's a very important skill. The other one is getting along with people. So showing that you are in a community or in your church, or you're a team player and a leader in events that in your career and outside of your career is very important. Today, it's also important to know a language because we are so international. Not critical, but you can look at the languages of the space program, like the European, Italian, German, French, Japanese. I could go on. As far as the future of the space program, we're going back to the moon and learning the skills to live on Mars someday, because someday we will send people to Mars. I would say geology is a skill that will be needed because the astronauts will be studying the surface of the moon and the surface of Mars. And I think I could go on. I think that's pretty much it. I do want to say, take a look at Katherine Johnson. So everybody knows who she is. She was the hero of Hidden Figures. She was a data scientist, by the way, although we didn't call them that back in those days. And look up Bessie Coleman. She was an incredible person, a Black woman back in the 1920s. Nobody would teach her how to fly. She wanted to be a pilot. She wanted to learn how to fly. She had to go to France and learn French to learn how to fly. And she came back to the United States and became very famous. So I just wanted to throw in that about role models, and don't ever say, I can't do something because maybe I don't think I live up to this lofty figure. You can do it. So don't cut yourself down.
Thank you so much, Colonel. Thank you. We're wrapping up now. I do apologize. I knew it was going to be a lot of questions. So incredible panel this year. All of our speakers, thank you so much, Dr. Knight. All right, Dr. Mccrary. And it's just incredible. It's an incredible day. I hope that you guys were inspired. And I'm going to actually introduce you to very important people here. And that is number one, Dr. Saeed. Basically, she is the division chair for the Nursing Allied Health Life and Physical Sciences Department and producer for this event. Dr. Saeed was recently honored with receiving the Educational Leadership College Level Promotion of Education Award. And today she would like to say a few words as we come to a close. Also after her will be Dr. Sharon Murphy, co-investigated with me for this particular grant for this, which is for the League for Innovation Grant for Community Colleges. Wonderful Dr. Sharon Murphy as well. But Dr. Saeed, you have a word?
Thank you, everyone. Thank you, Dr. Downs. You did a great job. Clapping for Dr. Downs.
Yeah, all right.
Excellent, excellent, and excellent. Wow, I felt so energized having so many powerful men and women in this forum. Of course, the men are promoting the women to do STEM, so excellent. I would like to give a big shout out to Dr. Mccrary for his wonderful keynote. It was excellent. He has mentioned that there are lots of jobs out there. Never give up, because there are lots of jobs out there. You are needed. Thank you, Dr. Mccrary, for the wonderful talk. We had Dr. Oloni speak about the public health careers. Wow, that was it was an eye-opening speech. Thank you so much, Dr. Oloni. That there are a lot of careers in public health. You just need to go find them. And as students, if you need to contact Dr. Oloni, his email address is in the booklet that we shared with you. All right. We had a very good talk by Dr. Colonel Collins and about lots of jobs in space, in the NASA, in the space fields, in data scientists. Wow, who knew that? Wow, it was excellent the way you explained that data scientists, welders, technicians, they're all needed. Wow, it was. Thank you so much, Colonel Collins. We really appreciate your insights. Dr. Hobson, we really, wow, the words she spoke were be determined, work hard, keep it going, find your passion, just keep it going, and dust yourself off and just keep it going, never give up. Thank you, Dr. Hobson, for joining us today and sharing your thoughts with our students. Dr. Wilson, the way you explained the careers in electrical engineering and wow, and there is no blueprint. I mean, it's excellent the way you explained it to our students. Just by reading the questions directed to all of you, it was excellent. Dr. Antoine spoke about the diversity. The diversity is needed. There is a dearth out there, and we need to tackle challenges. Students, young students, this is for you and for, I mean, wow, this is excellent, the way she spoke. And of course, Dr. Knight, Dr. Mccrary Knight, wonderful. Never be intimidated by the boys around you. I like what you said. I like what you spoke about. We all like about how you spoke about that there's a dearth of women scientists, a woman in STEM fields, and just keep it going. And about your own life experiences. I'm sure just by looking at the chat, a lot of students could resonate. Being single parents, juggling between jobs, we could resonate with you. Students have been texting me, emailing me that it's wonderful, and I am so honored by. I mean, seriously, it was wonderful. I'm so honored by having all of you here in the panel with us today. I would like to give a shout out to Dr. Peter Plod and Janelle Merrow for the technical support that they've been giving us. Thank you so much. Dr. Plod and Ms. Morrow, you have been wonderful. Seriously, in a very short notice, turn around, Facebook, this, that, wow. I'm not a technical person, but all this, it was synchronized by Dr. Peter Plod and Ms. Janelle Merrow. Thank you very much for that. I would like to give a shout out to Dr. Hamilton, who gave the welcome note, but she is the superwoman behind these events, and she doesn't like to be in the limelight, but I like to acknowledge her that without her support, these type of forums and these type of activities are not possible. So thank you, Dr. Hamilton, and the Office of Academic Affairs, Dr. Potter's office, and of course our president was here, Dr. Dr. President Mason had joined us for a good 20 minutes. If anyone noticed, I mean, he was on board and he was texting me. He was really enjoying these. It was excellent. It was a big honor for us to have our UDC president on in this forum. Thank you to him. And excellent. Thank you, everyone. Dr. Murphy, of course, thank you to Dr. Murphy and Dr. Downs for being the PIs of this conference. Thank you to Dr. Yusuf for his support, behind the scenes support. Dr. Palash, thank you so much. Thank you to all my colleagues. Dr. Kato is here, Dr. Aika, Professor Eagleson, who did some editing of the books. Lots of spelling mistakes. English is not my first language, but she fixed the spellings, and wow, it was wonderful. Thank you to everyone. I'm really appreciate it. And please, students, keep in contact, stay in contact with the panelists. Keep in contact. The email addresses are there. Now it's your turn. You need to keep in contact with these panelists, and the panelists will be helping you and to keep you targeted, motivated, and encouraged towards STEM fields. Now, I would like to end by giving a little bit time to Dr. Murphy. Dr. Murphy, please.
Good afternoon, everyone. Thank you, panelists, and thank you for our presentations from Dr. Mccrary and Dr. Olani. I hope that all of you enjoyed this wonderful forum this afternoon. And if you could please complete the satisfaction survey, and the students who would like to receive extra credit, the link is also at the bottom of the satisfaction survey, the information for you to complete to receive your extra credit during your classes. And I will turn it back over to Dr. Downs. Thank you for doing such a great job as the moderator.
Yes, you're too kind, Dr. Murphy. All right, so yeah, you guys was incredible. Just an incredible actual forum this year. It's better and better each year, and so it was so exciting. I hope you were inspired. I was. So and so basically, that's it for this 6th annual, if you will, Women Informs STEM forum. All right.
Thank you so much, guys. Thank you for your time. Thank you for your time. And well, women and men rock. Excellent. Very good. Thank you so much. Thank you.
All right. Yeah.